Well, I'm going to go ahead and just kind of get started with our welcome. So good afternoon. I almost said good morning, but good afternoon, everyone. And thank you all for joining us. Welcome to Randall Children's Pediatric Grand Rounds. I'm Christy Capra, and I'm your PediNet coordinator. It's so nice to have you all here today. So before we begin, I just want to remind you how to claim your CMEs. So there's a QR code listed on the slide. So you guys can easily scan your credit. And remember, you only have 30 days to do this. Of course, reach out to us if you have any questions or need further help. At the end of the lecture, there will be time for questions. So please type your questions in the question tab or raise your hand, and I can unmute you and you can ask your questions at the end of the session. So let me introduce our wonderful speakers today. We've got Dr. Mary Sperling and Dr. Danielle Pappas. I told you I was going to say that wrong, but welcome you guys. So I'm just going to give you a little bio on them. So Dr. Mary Sperling is the current past president on the board of Oregon School Psychologists Association and serves as a school psychologist in the Salem-Keizer Public Schools. Mary holds a doctorate in educational methodology, leadership, and policy from the University of Oregon, an educational specialist degree in school psychology from George Fox University, a Master of Arts in Liberal Studies focusing on learning disabilities from Dartmouth College, and a Bachelor of Business Administration from the University of Portland. She is a nationally certified school psychologist. Mary's professional interests include autism, traumatic brain injury, and learning disabilities, with a strong commitment to creating safe and supportive school environments where all students can thrive. Outside of her work in school psychology, Mary enjoys life on her family's chicken, goat, and berry farm with her husband of 34 years. She's happily and uncontrollably brags about her 3 sons who are now amazing adults. That makes me sound, I love that. And Dr. Danielle Pappas is practicing school psychologist with the Salem-Keizer School District, adjunct faculty for multiple graduate training programs in Oregon, and the current president for Oregon School Psychologists Association. She has served in schools or academia in the field of school psychology for 19 years. She is highly trained and experienced in evaluation practices for culturally diverse students and those with autism. She has a bachelor's degree in behavioral science from Northwest University and a PhD in school psychology from the University of Tennessee, and she is a nationally certified school psychologist. When not practicing school psychology, she enjoys spending time with her 4 kids, ages 16 to 24, and her husband of 30 years. She also enjoys crocheting, reading, and spending time at Disney parks. Sounds fantastic. Well, welcome you two. Thank you so much for being here. I'll hand it over to you.
All right. So next slide. Previous slide. So the title of our presentation is Partnering to Support Children in Schools, and we're representing the Oregon School Psychologists Association. The objectives of our presentation are to improve patient outcomes by efficiently collaborating between schools and physicians, distinguish medical and educational processes to access support for students with disabilities, and to recognize forms commonly sent to physicians from educators. Neither of us have any relevant financial relationships to disclose with any companies or anything. We're not selling anything or distributing anything. So that's our disclosure. All right. Thank you for this opportunity to present today. We're very pleased to be here and share with you about school psychologists, who we are, what we do, and how we can work together. We could not do our jobs without you. Physicians care for children and their families in a clinical setting. You connect them with resources and make recommendations for their support. Today we will explain how we develop plans for students in schools and suggest how you can support parents in communicating with schools about those services. Hopefully this will equip you with even more tools to help the kids and their families when they leave your office. Danielle and I are board members for the Oregon School Psychologists Association. OSPA's mission is to support school psychologists through advocacy, professional development, and community partnerships to promote excellence in education, mental health, and diversity. Our vision is that all children and families will thrive in school, at home, and in their communities. I also wanted to briefly mention that there is a national shortage of school psychologists, and this is true for Oregon as well. There are many reasons for this, and we're working on solutions. Also, we love our acronyms in special education, and we will try to avoid getting carried away with those. So let us know if you need us to clarify anything. Please go ahead and message Christy. She will let us know we are okay with being interrupted. So who are school psychologists? School psychologists are uniquely qualified members of school teams that support students' ability to learn and teachers' ability to teach. They apply expertise in mental health, learning, and behavior to help children and youth succeed academically, socially, behaviorally, and emotionally. School psychologists partner with families, teachers, school administrators, and other professionals to create safe, healthy, and supportive learning environments that strengthen connections between home, school, and the community. The school psychology services can look different from one district to another. For example, in my current district, I serve many schools from a central location with a large focus on evaluation. In other districts, school psychologists may be embedded in the schools and encompass more of the National Association of School Psychologists practice model, which we'll talk about in a minute.
So school psychologists are highly trained. So it's important to understand we're not just coming in with a bachelor's level. We have a lot of education. School psychologist minimum requirement is a master's plus 30 credits. So typically a master's degree is about 30 to 40 credits. But to get licensed as a school psychologist, you have to have a master's plus 30. So there are some universities that still issue a master's plus 30, and then there are others who have moved to what they call an educational specialist degree. So this one up here, the EDS, is an educational specialist degree, and that is a master's plus 30. So the minimum credits there are 60. The program I was just working with had a minimum requirement of 65. So it's anything over 60 would qualify for an EDS, or you can get a doctorate degree, which is of course 90 hours above the typical. I mean, usually it's around 100 credits, you all know. So it is just above and beyond. So it's a master's plus 45, and then over would get you a PhD. So there's different concentrations for school psychologists. You can get a PhD with a specialty in school psychology, or you can get, like Mary, you can get a doctorate in education leadership. So it's that EDS level, that master's plus 30 level, that gets you licensed in your state. So here in Oregon, we have an organization, Teachers Standards and Practices Commission, that license us. In order to work in the schools, you have to be licensed by TSPC. You can also get licensed by the National Association. It's not a license, it's a certification. So a national certification, which just recognizes that you have the skills to practice the entire practice model. Last thing that I'm going to mention in our training is we have to have a 1,200-hour internship. And that's a supervised internship, which usually takes about 3 years after the bachelor's level to complete the master's plus 30 or the EDS degree. So that that last year, 1,200-hour internship is basically a whole year in the schools. So they spend a whole year under supervision to gain the skills they need. So we do have, as Mary mentioned, the National Association of School Psychologists is our national organization that kind of leads all of our model and all of our practice and all of our requirements for our training. So this is the practice model that we actually do in the schools, and we have skills to do all this. Now, as Mary mentioned, our roles are different depending on what school we're in, but we are trained in all of these areas in order to be able to provide whichever services that school district needs. So you'll see at the top of our little circle here, which is kind of small to read, there are two things that are kind of foundational to our skills. We are good at data-based decision-making. So we have advanced knowledge in psychometrics and statistics, so we gather data that way. We also gather soft data like interviews, observations, those things that don't have numbers attached to them, but they're still valuable information. So we are really good at collecting all that data and then helping teams analyze the data and make decisions based on those, which kind of goes with the next one, which is about consultation and collaboration. So we might collect a bunch of data, but we are never the sole decision makers. It's always a team. So we work in teams, we consult with teachers, we consult with administrators, we work with parents, which comes in some of those other ones later. We also can provide direct services with students. So these over here, we can provide direct services for academic support. Some kids, before they go into special ed, we provide services in the general education classroom, helping them with interventions for kids that maybe just need a little extra help. They have small groups. I'm sure most of you are familiar with that kind of a model, which provides extra services to the kids based on what they need. So that's academically, but we also provide services for behavior and mental health as well. So some school psychologists provide actual direct counseling services. Sometimes they lead specialized group services if they're working on like anger management skills, or if they're working on social skills, the school psychologist can provide those direct services as well. We also can work on teams and with others to provide those services. And then there's school-wide based services. So we will we'll help teams basically at the school level read data. So a lot of schools now are doing a great job at collecting data on kids' academic progress, but then we help them kind of interpret the data, and we help them go through the data and make decisions about what we do next with those kids, if they need more help or if they're doing great, or maybe they need to be recognized, or whatever we're going to do with that data. So that's like a school-wide model for improving learning. We also help schools with school-wide models for safe schools. This could include anything from the climate in the school, so the kids feel emotionally safe, as well as the physical safety. So we can help with crisis intervention, crisis prevention, and crisis postvention. So in crisis, I don't necessarily mean, we all hear about gun shootings in schools, but also we have crisis here in our local school. We've had several recently where a staff member has passed away. Well, that's a crisis in the school. So kids were attached to that person, staff were attached to that person, and now we have to deal with the post for that. So school psychologists are often involved with those things and in planning for those things, and we're trained on how to do that. And then there's also this one here, which is what we're doing today, collaboration with community and families. And this is a great example of how we do that. So we're here to help you guys understand what we do so that we can work together to help our kids. We also help connect parents with other community services as well. So that's part of that, that domain. And then there's kind of our foundational things. We are trained in diversity. So we are constantly trained in diverse skills, making sure that we use equitable lenses across all the different, we live in a very diverse culture here. We're in Salem right now. So it's very diverse here. And so we are trained on how to work with all those families and to work with interpreters and translators, and to make sure that everybody's rights are met. The ninth domain is about research and evidence-based practices. So we're familiar with research. We have to keep up with research. That's one of our requirements. We also participate. So we try to participate and contribute our voices to the research as much as we can. And then the last one, which is, I think, the foundation for most professional practices, is legal and ethical practices. So we have ethical models. We have lots of laws that govern what we do. So we are constantly updating ourselves on the laws because they're ever changing. But there are some foundational federal laws that kind of guide what we do. Part of our professional practice right now is on advocacy. We're doing a lot of advocacy around those shortages that Mary mentioned. So for OSPA, for our organization at the state level, that is a priority our members had said they want. So we are doing a lot of advocacy there. So that practice model kind of encompasses everything that we do in the schools. So we do a lot of different things, and we can wear a lot of different hats.
Okay, so how are students with disabilities served in public schools? It depends on what services those students need, and each student is unique. Some students are served as part of what would be considered Tier 1 interventions, which would just be the universal supports that the school has. That could be reading groups, math groups. There are all kinds of behavior support interventions and things like that are just available to everybody. If more support is needed, students may be considered for a 504 plan under the ADA Section 504, which provides for accommodations. Other students will be served through special education or SPED with an individual education plan or IEP that provides specially designed instruction. I also want to mention that schools provide screenings for speech and language, hearing, vision, often through involvement with the Oregon Lions Club, fantastic organization, reading and English language development for our second language learners. Schools may also arrange for dental screenings and things like that. One more note I would add is that any evaluation requires informed consent. Also, interpreters and paperwork would be in the parent or guardian's native language. That's used if needed for the whole evaluation process, from consent to eligibility and planning. We want to make sure that our parents, that we can hear their voices and that they have input into the plans that we're making. They're a very important member of our teams. Hang on a second. Someone might talk. A 504 plan is a formal agreement between the family and school to provide accommodations for students with disabilities in K-12 public schools. These plans are based on Section 504 of the U.S. Rehabilitation Act of 1973, which prohibits discrimination against people with disabilities in federally funded programs. These plans ensure that students with disabilities have equal access to school programs and activities. 504 regulations require that school districts provide a free and appropriate public education, or FAPE, to each qualified student with a disability who's in the school's jurisdiction, regardless of the nature or severity of the disability. And 504 plans fall under the jurisdiction of the Office of Civil Rights. 504 plans are created for students who have physical or mental impairments that substantially limit major life activity, that students that have a record of such impairment or are regarded as having such an impairment. So we have to determine whether the student has a physical or mental impairment, and that's made on a case-by-case basis and requires evaluation. So medical statements or reports are key in communicating students' needs for 504 plans. We've listed some accommodations that students may receive, but the list is endless. And it depends on the student's needs and the student's school environment. For example, I have on my list, the last one is elevator key access. And that was an accommodation on a 504 for a student with asthma that sometimes they needed it, sometimes they didn't. And their school was 2 floors. So obviously, a single floor wouldn't need an elevator key. But the other thing I would say about accommodations is that they're available for students, but students are not required to access them. So in the elevator key example, the student never used that accommodation, but they knew it was there if they needed it.
So then if they're eligible for special education, we have federal laws that determine what they think are disabilities that might be eligible for special education. So these are the list of that's under the federal laws that are categories for special education. So we're going to talk about these real quick because some of them require medical input and some of them, the medical input is optional, most of them. So on right up at the top, the first one there is autism spectrum. We do autism evaluations in schools. There's an asterisk there because for kids under the age of 5, so once they enter K-12, then we don't require a medical statement, but when they're under that, we do require a medical statement. The medical statement for, say, a 3-year-old doesn't have to say that you've diagnosed them with autism, but we just have to have a medical statement. So maybe you suspect autism, maybe you've referred them out for an evaluation, maybe they just have a language delay and you've noted that because you screened for that. Those are the things that you'll want to put on the medical statement. So the preschool evaluations for autism will ask for a medical statement. So put on there whatever it is that you know about the child will help the team look at autism. And then in K through 12, we do autism evaluations. The team can decide if they want to request a medical statement. Most of the time we don't, unless the parent says there is a medical diagnosis. Then we might go ahead and get a medical statement. There's several categories here that us as school psychologists don't deal with, like deaf blindness is one that we don't deal with a whole lot because usually that's a different kind of specialist. as well as deafness or hard of hearing, which is often known as hearing impairment. That also requires different kinds of specialists to do those. So we can be consulted. I know I serve the schools here in Salem Kaiser that actually serve students with deaf and hard of hearing impairments. So I am consulted and I'm part of a lot of those cases and those situations. Developmental delay is a common one. I think you probably see this a lot in medical. This is up to the age of 9. So kids oftentimes come in with some kind of delays. We evaluate for 5. There's 5 different areas in the K through 12 that we can use for qualifying, and for preschool, it looks a little different than the eligibility looks a little different than it does when you get to elementary. You have to qualify for 2 of those areas at 1.5 standard deviations below. So and they include things like communication, adaptive behaviors, social, emotional, and cognitive and physical. So physical is part of that as well. Emotional behavioral disability, school psychologists are heavily involved with this one. The federal law actually calls it emotional disturbance. Here in Oregon, we decided that was not a very nice terminology, so we changed it to emotional behavior disability. This is where kids who have any kind of emotional or behavioral difficulty with their behaviors or their connections with their peers, or depression, or even somatization where they're getting sick to their stomach because they're anxious over a test, those kinds of things, if they are to a marked degree, they would fall under this one, emotional behavioral disability. And then intellectual disability, you deal with that also in medicine. We do those evaluations. They include cognitive and adaptive behaviors. And then orthopedic impairment, we don't do a whole lot with that one because that's usually a PT or an OT, or it's already been diagnosed outside of schools. Specific learning disability is very common. It is the biggest category in special ed across the country because sometimes kids are just having trouble with learning. And so that's where they would usually fall. Speech or language impairment would involve the SLP, and vision impairment usually involves a vision specialist. So the 2 that absolutely require a medical statement, other health impairment. Oftentimes when you hear students qualified as other health impairment, it's ADHD. This is where ADHD falls in the regs. There's lots of other things, obviously, that are medical related would fall there as well. So it's important for us to clearly describe why we're qualifying under other health impairment. That medical statement is required, or they cannot be eligible there. Traumatic brain injury has an asterisk next to it because we will request medical information if it's available. Sometimes there is no medical information available. Sometimes it happened in another state and current doctors don't have those records. So we do have some workarounds in terms of doing some other procedures to try and get valid information about what the medical injury was. But we will usually seek out some medical information when a parent brings up a traumatic brain injury. So let's talk a little bit about all of those areas we just mentioned have actual requirements in terms of an evaluation. So the laws here in Oregon give us a prescription of what we have to do to qualify a student for those areas. So every evaluation to start the process to become eligible for special ed requires parent consent. So we cannot start an initial evaluation, even if in the schools we suspect a child has a disability. If the parent doesn't consent, we can't even start the process. Once we get consent, we get 60 school days, not calendar days, 60 school days to complete it. So within 60 days, we have to complete the evaluation and we have to meet. So if we're getting up onto our 50th day and we don't have everything put together for the requirements, we're kind of scrambling. That's oftentimes when you'll get calls from somebody at the school for the medical statement because they're up against this 60-day timeline. So we have to meet, we have to do something. So if we don't have the pieces, we don't qualify. Eligibility determinations are always made by a team. So no matter what we collect in terms of our data, what we get as school psychologists, what we gather from teachers, what we gather from you guys from the medical field, it always involves a team to make the decision. And the team always includes the parents. The parents are super valuable members of our team. And they know the kids better than we do. They are with the kids before we come into the picture, and they'll be with the kids long after we're in the picture. So parents are super important. Our evaluations might include some pretty important information for their medical treatment. So we will usually inform the parents if there's something in there that would be really useful for their doctors to know about, so that they can share that with you guys in the offices. Sometimes we'll hear something from a parent that will be like, oh, well, that sounds maybe like a seizure, or maybe this is something else that's going on with this child. Maybe there's a medical condition that's causing this issue, and we can talk to the parents about it. But of course, we're not medical people. So we'll put little things into our report to help them take it into the doctor and have that looked at. So having a disability alone, you can see that's highlighted there in blue. Having a disability alone does not mean special ed. So we're going to talk about that in a second. There's actually 3 criteria to be qualified for special ed. So just the presence of a disability is not a guarantee of a special education eligibility, because there are a lot of people in our schools who have disabilities, but they manage the school environment fine. And they're able to access their education without any extra help. So just a disability alone does not necessarily mean special ed. We do have some exclusionary factors on some of those eligibility areas, not all of them, but most of them. One of them is limited English. So this is part of our practice model where we have to be knowledgeable in culturally diverse practices. This is where this comes into play. We have to understand English development and how the language is developed in typically monolingual speakers, but also second language speakers. So we have to rule that out, that limited English is not the cause of the difficulties. And then there is lack of instruction in reading and in math. That applies mostly when we're talking about learning. If the kid doesn't come to school or hasn't been to school so much so that they've been missing instruction, then it's hard to say that it's a lack of instruction or that it's a disability. So that is in the law for us to look at those things. So a little more details about those special education evaluations. They might include, but are not limited to, there's lots of things that can go into an evaluation, but we do traditional IQ testing. So that does come into play when we're looking at an intellectual disability, or most of the time when we're looking at a specific learning disability, we'll look at cognitive testing. We do achievement testing as well. We almost always do achievement testing because we're looking at how they're doing with their reading, writing, and their math. We want to look at them on a national standard level and see how they're comparing. And then we do behavior evaluations. We can look at lots of different kinds of behaviors, the externalizing behaviors, aggression, hyperactivity, impulsivity, inattention, because we can often see that by behavior. We also look at mental health behaviors. So we look at depression, somatization, anxiety, which can present in some behavioral ways. We look at the function of the behavior. So we know behavior is communication. They're communicating something. So we do assessments to kind of evaluate what are they trying to communicate, what's the function of this behavior, and how can we meet that need in a different way if it's a problematic behavior. We also do evaluations for social skills. How do they relate to their peers? How do they relate to their teachers? And we look at social communication, which leads into autism. So when we're doing an autism evaluation, we of course have to do a full social communication evaluation. So it is required by law that we have an SLP as part of our team when we're looking at an autism spectrum disability. So we do a full social communication evaluation for that. There are other specialty areas that we mentioned. We were talking about the categories, and they would involve specialists such as SLPs, audiologists, OTs and PTs, and vision specialists. We have augmented communication experts, which are usually SLPs by license. So we have lots of different specialists that help with identifying those students. So of particular note, our autism evaluations do line up with the DSM-5. So they look exactly like the same diagnosis you would get from a private psychologist, or even you might use in your clinic. So they do line up perfectly with the 2 broad areas for autism, the social communication and the behaviors. We look at all of that stuff, same as you. So they should cross over. The intellectual disability evaluations do include cognitive and adaptive assessments, just like is expected from the AAIDD, their national organization. And let's see, some of this information would be provided to you because a medical diagnosis might open some of the community doors that the parents might be seeking some assistance. So if we have some things that we think would be available for DD services or for Social Security support or those kinds of things, we would provide those things to the parents to provide to you to help with those kinds of diagnoses. Some procedures that private evaluators would do overlap with the procedures school psychologists would do. So you may be in your clinic think, oh yeah, this looks like maybe it's autism. I'm going to have so-and-so private psychologist do my evaluation. That's fantastic. What they do sometimes overlaps what we do. And so we can't do the same things. Like if they give a cognitive test, we can't give the same cognitive test within a year because we have validity issues that way. So it's important to communicate that kind of thing. If they're seeing a private psychologist and they've done private evaluations, it's helpful for us to know what those are, and vice versa. If we've done some testing in the schools, it's important for the private evaluator to know what we have done so that we don't repeat things and then there's question about validity when we repeat things. So it's important that we communicate with the private evaluators. We're going to talk about med statements in a minute and who can sign them, because private evaluators, some can, some can't. So there's 3 ways. We've talked a little bit about the evaluation. We've talked a little bit about the categories to get special education. So there's clearly a big process to get into special education. And there's 3 actually requirements to get into special education. The first one is their disability present? So that's where we're doing that big evaluation, and we're looking to see if they have autism, if they have an intellectual disability, if they have a specific learning disability. We're looking for whatever the disability might be. But then the second criteria is, does this disability impact their ability to access their education? So what does it look like in the classroom? How is it playing out? I mentioned before that there are some kids who have disabilities, but yet they manage the general education curriculum just fine, and it's not impacting them. So we're looking at that. So a lot of our evaluations will have to look at how is it happening and how is this presenting in the classroom. When we do that, we're looking at the whole child. So first, we're going to look at academics. We're going to see, are they on grade level? Are they meeting classroom expectations? But then we're also going to look at how is the child dealing with the peers? Are they constantly fighting? Are they always being referred? How are they doing? Can they develop into a place where they're going to be working with pairs or partners or in teams? Or do they need some extra support to do that? Because we know, I mean, you probably know, as we do, a lot of our adulthood in our lives, we work on teams, right? We work in partners. We work with other people to collaborate, to make decisions and move forward. So we want our students to learn that too. So from a young age, we start partnering them up and putting them in teams. And so we're looking to see how the students can do that. Can they do that with their peers? Can they work together? Are they always the one in charge? Are they being bossy? You know, we're always looking at those kinds of things. So we have to see how it's impacting their ability to access the education. And then the third prong is, do they need specially designed instruction to access their education? What can we do in SPED to teach them to help them access their education? So that's like the last thing that we have to decide, that yes, they absolutely need some instruction. Maybe they have a disability and some accommodations can help them access their education. So we just need to give them a little extra time on the tests, or we need to give them a quiet place to take the tests, and that's going to handle it, and they're going to access their education just fine. Maybe we need to teach them specific skills on how to organize themselves, or how to turn in their assignments on time. Maybe they need to check in, check out. Maybe that can be an accommodation. Maybe we need a little more counseling involved with those kinds of things. So it kind of depends on the kid and what they need, but they absolutely need to have, they have to have a need for specially designed instruction for that last thing to be eligible. And the last note is that once they're eligible for 3 years. We have to relook at it every 3 years. We can look at it before that if necessary, but absolutely every 3 years we will look at it. You know, I often think, why would we look at it every 3 years? Sometimes, I mean, the goal of special ed is to give them skills to be able to access their education. And then they don't need our designed instruction anymore. They've met all their goals and they are on grade level and they're accessing education fine, and we can exit them from special ed. So that's why we check every 3 years to see if they still have the disability. Some kids still have the disability, but they've just learned the skills that they need to learn. And sometimes, I mean, let's be honest, sometimes we don't get it right. Like, especially those younger kids, you know, at 5 years old, autism, intellectual disability, and ADHD, they look a lot alike, right? Sometimes it's difficult to tell. So by the time they're 8, usually the picture becomes a little clearer. So it's nice to have that 3-year check to see what we really think is happening with the child. I like to say, instead of a wait to fail model, I like to say, watch them float. Let's let's watch them rise and let's watch them succeed. And if they're not, then we'll be there to check again and see what's going on. So that's our special ed.
Okay. So once a student's found eligible for SPED services, an IEP meeting has to be held within 30 calendar days. Sometimes the eligibility is determined and the IEP is created the same day, but this makes a really long meeting and it's an overwhelming amount of information shared with the parent. So we try to be really careful about this, and every family is different. IEPs are written at least every year, but they can be updated as necessary anytime. The parent just can say, hey, you know, let's take another look at this. This isn't right. Or the teacher may say, hey, they've met this goal. Let's see if we can change that. The IEP team includes the parent, the SPED teacher or case manager. Those are usually the same thing, the same person. A general education teacher, an administrator or district representative, and specialists that are part of that student support. So that could be the school psychologist, speech and language pathologist, occupational therapist, physical therapist, school nurse, school counselor, autism specialist, any of those people that are appropriate to participate in that IEP. Every IEP includes present levels of academic achievement and functional performance, recording how the child's doing in school and how their disability affects their involvement and progress in the general curriculum. So based on this information, goals are identified and goals are created based on what the team thinks the student can reasonably accomplish in about a year. If the student meets those goals sooner, like I said, the IEP can be updated for new goals. The IEP includes what special education and related services will be provided to the child and any changes to the program or supports. So that could mean determining where the student will receive the services, how they'll take district and state assessments, when services will be provided, by whom, and how long they'll last. So options for where they receive the services, there's kind of a spectrum of options for that. They include push-in support where a special educator will go into the classroom to support the student in the general education environment. Pull-out support, which I would say is the most common, where the student will come to the special education classroom and receive those interventions and specially designed instruction. And then a third option would be a self-contained classroom. And that's a classroom where they receive services for the most of the day in a special education setting. They will have access to general ed students and general ed classes when that's appropriate. And those are all decisions that are made by the team. So that team process is really important. There's a lot of information in an IEP. The instruction provided in the IEP is considered specially designed instruction based on the student's needs. Accommodations and modifications are also outlined in the IEP, and it's important that if any modifications to the general education curriculum are made, that keeping in mind that can have an impact on the diploma options that a student has when they're in high school. So all these decisions are made very carefully. Related services are identified on the IEP, including the minimum number of minutes and that the student will be served. And then data are kept on all the goals and reported several times a year. So then that way we know if adjustments need to be made. And again, that IEP team can get together and look at the data and make some new decisions. Now, full transparency about IEP meetings. They can spark the most beautiful discussions about students and how we can help them. There can be laughter, there can be tears, incredible creativity, and solution-focused love for the child. How we can help them grow in this way or that way, or maybe they can't do something yet, but they can do a piece of it. And so the plan starts to build from where the student is. Schools will request medical information to assist in making decisions for students. The requests can come from a special education case manager, a school psychologist, a speech and language pathologist, or other specialists in the schools. If you receive a request from a case manager, often that's because they're working with their specialists on the evaluation of the student, and the case manager is managing the paperwork, but they're making the request for the school psychologist or other specialists as well. Requests for medical statements are most often sent from the schools, but sometimes the parent or guardian will bring the paperwork to your clinic to be completed. When the school makes a request, there will be a HIPAA release attached. If there are any issues with how that release is completed, please reach out and let the requester know. For example, if there's a mental health information in the record, that the provider requires a specific consent and those boxes aren't checked on or initialed on the form, that's really easily corrected as long as we know. So we want to get it right. Just reach out to us. If you haven't seen a child in a while and are not confident that your diagnoses are current, let us know that too. Sometimes letting a parent know that will motivate them to bring the child in for a checkup. Families can be really busy and overwhelmed, and sometimes they need that help. There are many laws that dictate how schools accomplish things, and one of these is the timelines given for completing the evaluations, like Danielle mentioned. In Oregon, we have 60 school days to complete the evaluation, and that includes gathering all pieces of information, interpreting the data, making eligibility decisions, all of that. So timely handling of the medical statement requests is really deeply appreciated. Who can sign a medical statement? So according to the laws, a physician, nurse practitioner, or assistant, what's that?
I think we have a question.
Oh, okay. Let me finish the slide and then I'll pause for the question. A physician, nurse practitioner, or physician assistant can sign the form according to the Oregon laws. Unfortunately, at this time, a mental health counselor or psychologist signature doesn't meet that requirement. And there was a question.
Christy, where'd you go?
I think you just answered it. So Amy just asked that question. I often get requests for a medical statement. I'm a psychologist, a PhD. Am I permitted to sign, or should I forward to their pediatrician? And then I think you just answered that. She says, thank you.
We really wish that we could accept those signatures. And I know that there's discussion about having that changed. And I really hope that can be changed, but we need to have it from a physician.
So yes, providing it to the pediatrician to get the official diagnosis is what we need.
Yeah. Just how it is. Okay. Thank you. And thank you for interrupting. Okay, let's take a look at a sample medical statement form. I have the first part of the form here. Note that at the top, the child's information and instructions for returning the form are included. Sometimes the requester will add a letter to the packet with the other information about the request and how they'd like the form returned. If you have secure email systems or other ways of returning the information, just let us know. We'll be happy to work within your processes for that. Also note that the requester should be checking which boxes they want you to complete. So for example, box number 1 is about vision problems, and that's for students who are being evaluated for SPED services under vision impairment. This doesn't apply to the majority of the requests that are made. This box should be completed by an optometrist or ophthalmologist when needed, but most of the time that doesn't need to be completed. Box number 2 would be requested for a student being evaluated for hearing impairment, also not common. Box number 3, also not common, but it should be completed by an otolaryngologist. I knew I was going to mess that up. Otolaryngologist or other physician. So looking at the second half of the form, so the next slide. Box number 4 addresses medical issues that contribute to speech and language problems, but the most common boxes are the ones that number 5 and 6. Those are the most common boxes you'll see checked, indicating that the requester wants you to complete information about health impairments and physical, mental, sensory, or mental health conditions that affect educational performance. So in my own estimation, I would say boxes 5 and 6 are the only ones needed in like 95+% of requests. please write legibly. We want to be sure that we're accurate in how we're reporting your information. And finally, the signature, please make sure to date the form, and below the signature, print your name and title. We will be putting this information in our reports and on our eligibility forms. And again, we just want to be accurate. If I can't read it, I will start Google sleuthing to figure out who you are. And, you know, I do that a lot. I'm pretty good at figuring it out, but if you can print, or sometimes a provider will have a stamp that has their name so that we can just be clear about who's signing the medical statement, we really appreciate it. I'm still there. This sample medical statement is the form from the Oregon Department of Education website. Some medical statements may look a little different, but most have a format where there are boxes that you're being asked to complete will have a check next to them. So that's good news, because you don't have to complete the whole form. You just have to complete the boxes that are requested. Was there another question?
Yeah, Dr. Lena Quo is asking, if no boxes are checked, do we just fill out all the sections?
If no boxes are checked,
Probably, because it'd be really fast to do the top ones is no, 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 no.
Or just say NA, you can say NA on them, but it's most likely if none of them are checked, they want 5 or 6. Yeah, that's a great question.
That's a good question. That would be the safest thing, that way you don't get it request again.
Yeah.
Amy just wants to know if, a good afternoon, will you be sending the slide decks to participants to review? And Dr. Quo says, thank you.
Yes, I think, Chris,
yeah, we can.
You're sending them?
Yeah.
Okay, yeah.
Yeah, we can.
Okay.
Yeah, perfect. Yeah, thanks.
All right. Okay, next slide. So you have HIPAA, we have FERPA. In both cases, we're protecting the privacy of our students and your patients. So when you send medical records to schools, then that record becomes part of the student's student record. And student records are only disclosed for specific purposes, including to schools where the student's transferring. If there's a health and safety emergency, it can be disclosed to the appropriate officials, or to comply with judicial order or lawfully issued subpoena. And I've provided a link there to the CDC that gives further details about HIPAA and FERPA and how they align.
So we've learned a lot. I think we've told you a lot about special ed and schools. So here's the crux, like how do we partner together to make this easier for kids to get services in schools? So we got a yes, please, and just a little bit of a no, thank yous. So yes, please be responsive to medical requests. We've already talked about that, about timelines. Mary just talked about make sure your name is on there that we can read it, because we will have to transfer it into our documents. We want to know who you are. Feel free to ask questions. So if you're not sure about what we want, if you're unsure about what's going on, feel free to ask questions. Help parents understand that there's a process at school. So you have a process in your office, we have a process at school. So they look different. So help them understand that when you go to the school and request for help, there's going to be a process. And there's a timeline. As you know, 60 school days is 2 months. And actually it's a little longer because you take out the weekends, right? Mm-hmm. So it is a little bit of time. Obtain an ROI if you want to share information. If you know that there's a medical diagnosis that might impact them at school, or a mental health diagnosis that might impact them at school, and you want to share that with school, obtain an ROI, provide that to us, provide the information, have the parents agree to, share information with each other. That would be very helpful. Encourage the parents to contact the school principal or the special educator. So every school has principals and every school has a special educator of some sort. Sometimes there's lots of them. And usually that's who they should contact, because those people would know how to start the process and they know what the rules are. Like when a parent requests an evaluation for special education, we have to respond. The school has to respond within 10 days. The principal knows that, the special educator knows that, and we will be responsive to the parent. So that's the person they can go to get the ball started. Let the parents know that there is going to be a process. It's going to take some time, and we will definitely respond. We are not going to ignore them. And we will definitely take some time to collect some data about their child so we can have a meaningful conversation. The only thing, there's 2 bullet points there on the no, thank you, but they're basically the same thing. Prescriptions work at pharmacies. They don't necessarily get filled at schools. So the problem with prescriptions in schools is that some parents, some of their cultures really see doctors as authority, right? So they think the doctor has given me this piece of paper, so the school must do this thing for me. And so sometimes that creates some confusion. And it makes, us look like the bad guys, because we have a process. We have a legally defined process from both the federal and the state on the processes we have to follow. And so we love to get that medical information provided in a note. I know I've seen doctors just write a single note that says this child has a diagnosis of ADHD and may need some help at school. That'll start the process rolling in the same way that you would use a prescription to get a medication to help treat that condition. Same idea. So help the parents understand that, prescriptions are not filled at schools, and any documentation from the doctor about a diagnosis would help get the ball rolling. They can request the ball rolling without a medical diagnosis. So it doesn't have to have, they don't have to have a diagnosis. It could be a suspicion. Maybe you suspect something is going on and you refer them out to a private evaluator. The parent can still come to the school and say, hey, we suspect this is going on. Can we start the process of looking at this? And we can start the process. So help the parents understand that so that we can help them understand our processes and we get help for their kids. Do we have a question?
I think we did.
You do, yes, from Elizabeth. So she says, I'm not sure if this is an appropriate question, but it has come up a lot recently. Who evaluates for dyslexia? I was under the impression this can be done through the school, but we are getting a lot of requests for us to facilitate this. And Elizabeth, I have that on my list of questions too. So
yes, we could do dyslexia in the schools. Dyslexia is, as you know, a reading disability. So in those special education eligibility categories, it falls under specific learning disability. So it would be under there that we would do, we could refer for specific learning disability and we would look at the reading. And we have a lot of instruments that actually do dyslexia screeners. So they specifically look at reading. And so we can do that. We don't diagnose in schools, so we can look at it and we can qualify them for services as a student with a reading disability, but we don't diagnose in terms of insurance or any of that kind of thing. So, but if we do a specific learning disability evaluation, that information may be helpful to you guys in terms of making a diagnosis if that's what the parents are looking for.
And that evaluation can look different in different districts too. So some use a model called response to intervention, where they try different interventions. And if those interventions aren't successful, then they'll find the student eligible for special education. That's a really oversimplified explanation, but that's it. And then we use kind of more of a hybrid model, pattern of strengths and weaknesses, where the students have interventions and we have data on those interventions, but then we do some testing to help us understand how that student processes information and where they are with their reading, writing, and math. And we look at all kinds of pieces of data, their curriculum-based measures, the data that we collected through testing, observations in the classroom, file review, all that information. So dyslexia is tricky because another thing that I would say, I don't know if this is controversial, but sometimes a student will have dyslexia or could be diagnosed with dyslexia from the medical side, and maybe not meet the eligibility requirements for special education services. So maybe they need more accommodation than specially designed instruction. It just really varies. And so that's why our evaluation is really important. And it's really important for us to team with the medical providers as well.
So we do look for, if we're looking at a reading disability, in order to be eligible, their reading skills actually have to be below average. So if they're coming out like in a standard score, you guys are probably familiar with those, 85 is the bottom end of the average range. If they're coming out an 85, that might be low enough for, say, a medical to say, oh, it's a reading disability. But in schools, 85 is the average range. So it wouldn't necessarily qualify for a specific learning disability at 85. So we do have to see a reading deficit compared to their grade level norms. Mm-hmm. And so that's a little bit different in terms of how we identify it. But we can provide all that information and detailed explanation of what we did in our reports. So it would help help you guys in terms of making diagnoses.
And if the parent wants us to share the reports, we can do that if we have their permission with the release of information. Or they can have a copy to take to you. I feel like we have a lot of information that could be valuable for you. Same as you have a lot of information that's really valuable for us. And our goal is just to really support the students the best we can. And the goal always is to have students become as independent as possible.
Yeah. So more questions?
Yeah, thank you. Elizabeth says, thank you so much. Yeah, and I do too. Yes. Yes. What other questions do you guys have for them today? I'll let you guys go ahead and think about those and put them in the chat. I'm just curious if you're seeing the rise of anything specific in your schools. Like, is there a new trend? Like, what's the new trend that you guys are seeing? That might be opening a can of worms.
There's lots of headlines about behaviors in schools. We are seeing an increase in behaviors. Some of them are mental health based. Some of them are lack of preschool. I don't know. There is a rise in autism, but they've noted the rise in autism is more about identification than it is about actual prevalence. So I've had a huge rise in my autism referrals this year. So I think people are just becoming more and more aware of what it is. And so we are seeing a bigger increase in autism. We see a lot of explosive behaviors in the classroom, people, students having difficulty regulating their emotions and behaviors. We often try to serve those kids in the general ed and give them some interventions there before we identify necessarily as an emotional behavioral disability. We try to work in training them and teaching them new behaviors and how to replace the problematic ones with ones that are pro-social and more community friendly for schools.
I'd say anxiety is a really big one too. Like, we're seeing that so much in middle and high school. And it's real. I mean, the anxiety that the students are feeling is real, and it's getting in their way of, sometimes it impacts attendance. Sometimes students are trying to access the calming rooms in the schools much more than we would expect them to. I'd say that one's really huge. And there's such a need for mental health supports. And I know, like we mentioned before, there's a shortage of school psychologists, and we're just really hoping that students will get access to mental health services when they need them. And I tried to find the statistic before this presentation, but I forgot. Then I forgot to. But a large number of students only have access to mental health supports through their schools. And so having like a surprising number, it's like 70, it's really high. It's really high. And so having trained professionals in the schools is really, really important. So
to go with the anxiety, as we know, is kind of a cousin of depression. They tend to go hand in hand, and kids will get anxious and then they'll get depressed about being anxious. And so they tend to go hand in hand. So we are seeing that also in the schools on a higher prevalence than we used to.
Oh my goodness, thank you. So Amy says, who also is, she says, I often see patients with very intense behavioral emotional challenges. Does every district have an option of higher level of support, special schools? In PPS, for example, it's Pioneer School.
So every district is different, and every district needs to serve their students. So sometimes that means placing the student outside of the district. And, sometimes for that to happen, a lot of data needs to be gathered, a lot of supports need to be tried. There are many, many things that need to happen. For some students, they're placed in like day treatment programs or inpatient programs, and then it becomes like more of a medical model. So those are complex situations, and they do happen. I would say Salem Kaiser is unusual in a way that we just this year opened a program for students with those high needs, behaviorally and emotionally. And we have students in that program from outside of our district.
And
So
it quickly reached its capacity.
very quickly.
We're looking to try to expand it.
Yeah.
So we do have, and that we're a large district, like we're the second largest district in the state. So not every district has the ability to serve the kids, which is why we're talking about outside placements. Larger districts tend to have more resources, and so they can problem solve these things a little bit better. That's not necessarily equitable across our state. So that is an issue.
And it can be tricky too, because depending on where that placement is available for the student, that could mean a really long bus ride too. So, you know, how they arrive at that program after a super long bus ride, you know, there are many factors that the students team will be looking at to try and get the right supports to them.
And we do see, I know that came from a private practicing specialist. A lot of those kids with high behavior needs have private practicing specialists that are supporting them, like yourselves.
And we appreciate you so much.
Yes, so much.
Likewise. Oh my goodness, fantastic, you guys. Does anybody else have questions for us today before we conclude? You guys, I have Dr. Allen has his hand raised. Let me unmute you. Maybe hold on. Let me see if I can. Goodness. All right, I can do this. Hold on. Allow mic. Here we go. There you go. Go ahead. Go ahead, Dr. Allen. Dr. Johnson. Oh, maybe did I not do it? Oh my.
Okay, can you hear me now?
Oh goodness, perfect. Yes.
Okay. Sorry.
Dr. Johnson, thanks.
Yeah, thank you. My daughter is a school psychologist in a suburb of Seattle and feels she's very pleased that Washington has a high priority for having school psychologists available in all the schools. It sounds like the school districts in Oregon may have to rely on private school psychologists. And does that mean the school district picks up the fees for those private psychologists?
Depends. Sometimes, yes. Most of the time, if they're using private psychologists to do what we require for special ed, like evaluations, then yes, we have to cover those costs because they're required by law. So the district is required to provide that service. But if it's just extra support outside of school, then not necessarily. So I'm happy to practicing school psychologists in Washington. Washington also has a shortage of school psychologists, but they have more than we do. Oregon is actually in worse shape in terms of the numbers of school psychologists in our schools. And so we are stretched much thinner for sure.
And Oregon is unusual in a way because to become a school psychologist in Oregon, you have to be on the west side of Oregon in Eugene or Portland.
Only two training programs
right now. And Lewis and Clark just started this year a distance program so that people from other parts of the state could become a school psychologist, but it's, you know, very small and just getting started. But I know there are fantastic educators all over the state, Eastern and Southern Oregon, that would be great school psychologists, and just having access to the graduate programs is a concern. So, and there are a lot of districts in the state that don't have school psychology supports. I would love to see that changed. I know that there are a lot of distance or remote school psychology companies that will like contract school psychology services remotely, or traveling school psychologists kind of situations. But of course, I feel, and I would imagine that Danielle also feels, that being part of that school community is really important and the best thing for the students, because we know the students, we know the teachers, we know the families. And we know the community. So yeah, it's a big question, and it's a problem that a lot of people are putting their heads together to solve.
It's expensive for schools to pay for the private psychs, you know, so.
Great question. Yeah, fantastic. Oh my goodness, you guys. Well, Thank you. Thank you all for joining us today. You guys, wonderful presentation. We really appreciate your time. I will send the slide deck out to, I think it was Amy that requested it. And yes, and she says, thank you for the helpful information. You guys, we really appreciate your time and look forward to working with you again in the future.
One more comment, Christy, before we run off. In the fall, OSPA will be producing a flyer, like a one-page poster, like an infographic with a lot of this information on it that our school sites can provide to their private practice and pediatricians around the state. So we'll provide that to you if you're interested. When it's ready to be published, our new board comes in this summer and they'll approve it. So it'll be in the fall, but we would be happy to share that for anybody that would like it.
Fantastic. Absolutely. Yeah, we would love that. Yes. Melissa says, thank you. Amy says, thank you for the helpful information. Yes. Thank you guys so much. And thank you all for joining us. Have a great
Thank you for
rest of
having
your
us.
day.
Thank you for having us.
Have a great day.
Take care, guys. Thank you.